Welcome you all to this webinar on global health security and COVID-19 epidemic issues in perspective. This is organized by Research Council of North Lakhimpur College Autonomous and Internal Quality Assurance Cell, IQAC, North Lakhimpur College Autonomous. And I'm very glad that four of our panelists have agreed readily within a very short notice to provide their opinion on this very crucial issue. And we would like to start with this meeting by the welcome address given by our principal. So I'm going to play a short video that has been posted by him. Just wait for a second.
Hello everyone. I am Dr. Biman Chandra Chetia, Chairman of Research Council and Principal of North Lakhimpur College Autonomous. Welcome you all to the first ever webinar organized by our institution titled Global Health Security and COVID-19 Epidemic Issues in Perspectives, organized in collaboration with IPC of our college. We all know that COVID-19, or popularly known as coronavirus, has been creating a serious concern for human beings. Almost all the nations of the world are suffering due to it. Therefore, there is a need to discuss more about in it details. I am glad to inform you all that our institution has taken initiatives to aware people of these issues since its inception. We believe together we can fight this epidemic. So on behalf of organizing committee, I welcome the panelists and the participants to this webinar. Let us make this webinar a success. Thank you very much.
India. I would like to welcome Dr. Pankaj Kumar Sharma. He's an assistant professor from KVV SAS University, Assam. We have amongst us Dr. Kaustubh Deka, assistant professor, Department of Political Science, Dibrugarh University. We have amongst us Dr. Dipmani Gogoi, MET University, New Delhi. We have amongst us panelists Dr. Yogen Bhutia, assistant professor from SRM University, Andhra Pradesh. And we also have a good number of participants from our institute and also from other parts of Assam and India. I can see some of my esteemed colleagues have also participated, and my student friends. So I welcome you all to this webinar, which includes a very, very important issue, which all of us are going through. We see that the entire world now has been under this epidemic called COVID-19, and due to this COVID-19, the entire global health security situation was put in a very serious question. So we need to redress and understand what is the impact of this COVID-19 on this global health security. We will make a discussion on it. Now, I would like to invite Dr. Kaustubh Deka, Dibrugarh University, to kindly deliver his speech. Yes. So he will talk about locating global health security during COVID-19 issues and concerns. Over to you, Kaustubh.
Thank you. You can hear me?
Yeah, we can hear you. Yeah. Audible. Yeah.
Can you hear me?
Yeah, you're audible. Yeah.
Yes, we can hear you.
All right. Okay. Thank you, my friend and dear colleague, Chuchengfa. This is a much needed initiative to hold this webinar at this moment, because all of us are really grappling with a lot of concerns and a lot of kind of challenges at this moment. And the topic that is assigned to me today is extremely challenging, I must say. And within the 10 minutes assigned, let me try to quickly highlight the main points, and we can further take it for discussion. And my dear colleague Pankaj already actually, in a way, touched on a lot of the points. That is also part of this topic of global health security regime. But let me begin by just quickly, in a way, working out the three main themes in this topic, the way I would like it to take forward. First of all, what I would like to understand is that what is new in this COVID-19 outbreak? What kind of new challenges it poses to international or global public health security? Second, what is relevant for our region, that is India as well as Southeast Asia? And finally, what are the implications for a region like Assam or Northeast India, which is in a way placed in a very critical juncture, also being zone of international kind of borderland.
Mhm.
So these 3 points. So let me begin by going to the very brief but very useful definition of global public health security, which is given by WHO. And let me read it out these 3 lines. WHO says that global public health security is defined as the activities that requires both proactive and reactive to minimize the danger and impact of acute public health events that endanger people's health across geographical regions and international boundaries. So there are lots of important key points here. It talks about, first of all, of course, across geographical boundaries. So this has to be an outbreak that affects people across geographical boundaries, and something that is acute and threatening for public health at large. So, of course, so these 2 things is very pertinent for today. I mean, this is definitely one of those occasions which qualifies as a global public health security hazard, the COVID-19. Now, coming from that definition now, what we have to understand is that it's very relevant for us to know that there have been few other outbreaks in last, say, decade or so, and which had, in a way, given some understanding to the world governments, NGOs, and other groups as to how to approach a global health security kind of a situation. So that one of the outcome of that was that in 2014 there was an initiative called Global Health Security Agenda, that is GHSA. So GHSA was the outcome of this deliberation mostly regarding SARS and Ebola. Remember, those were the days of this other kind of public kind of health hazards like SARS, Ebola, and few other kind of this type of pandemic kind of a situation. So this group of 67 countries came together and they initiated this thing called Global Health Security Agenda, which was initially endorsed by that group of 77. And later on, actually, more interesting is that it was linked to what we call as IHR, that is International Health Regulation, which is binding on all the members of World Health Organization. So in a way, this GSSA was linked to IHR, and then it became binding to all the WHO members, and including India is now a member of this initiative. So this initiative was one occasion that gave people a lot of way to address and think about how to approach a pandemic kind of a situation. And it has kind of three key words that was basically prevent, detect, and respond. So you have to, first of all, prevent a new pandemic from outbreak. Then, if at all it outbreaks, you have to detect in which way it is kind of spreading. And finally, you have to respond. So this is the global kind of approach right now in any kind of a pandemic situation. So now the question, of course, has been raised that how far this type of a solution is feasible, because given the way that COVID-19 seems to be, in a way, on non-stop, you can say, in a way, path of destruction, it is actually swallowing up countries after countries now, and there seems to be no end in near kind of a future. So there has been some re-evaluation done on that. Some assessment is being done how far this type of approach is useful. But what the you can say the people involved are pointing out is that because of this kind of mechanism in place, they have been able to share more information across more data. Data sharing has been more, in a way, relevant or more fruitful, more efficient. That it has made a positive impact. But here comes a complicated angle. That is that strategic geopolitical considerations have always been, in a way, complexly connected with any kind of multilateral negotiations or multilateral kind of initiatives. That is one point which is very crucial for a country like India, because now what we have seen that India is placed in a very precarious position, because one, India has to, in a way, think about its geopolitical concerns in international forums like United Nations and others. At the same time, India has to also balance those concerns with the regional realities of the subcontinent. So these two things have to be kind of, in a way, aligned. And by geopolitics, what I mean is that this pandemic will definitely recast global health in terms of health security concerns. So health security and global health will become more kind of connected than ever before. Of course, it was always very connected, but now the connections are becoming more. apparent and more significant. So, coming to India, what India should do, or perhaps India is going to do, is that, in my opinion, is that all the multilateral organizations and the forums that are there now, because there is this geopolitical kind of considerations that have come there, and the role of China is under close scrutiny by different monitoring organizations as well as countries. India will have to consider the options very carefully. There are those who are actually advising India that India can, in a way, revitalize and take a leadership position within the BRICS initiatives now. It's the right time to activate forums like BRICS, because these are the times when we need this forum of regional cooperation. That is one. And South-South cooperation is very crucial at this moment. Although there are a lot of talk of isolating China, or in a way using the opportunity to gaining more prominence in terms of international trade and others. But what we have to understand is that North, especially led by countries like US, and of course we should not forget the crucial role of European Union also here. They have their own considerations, especially regarding, in a way, increasing drug price, international drug market monitoring, kind of a lifting restrictions from, in a way, export. So they have their own international political economic agenda and considerations. India have to be extremely careful in this moment to, in a way, calculating all the options. And South-South cooperation should not be abandoned altogether. In fact, this is a time where regional cooperation has to be more prominent and more effective. And coming to a region like Northeast India, because we have seen that this is also the time that, as my colleague Pankaj also pointed out, that security is moving away from traditional concepts and concerns. So we have to understand that this is also a time where we are seeing that in peripheral areas where health infrastructure was not so much in place, we have our own challenges to meet. So we have to be very careful when we talk about. We have to understand that we cannot abandon, in the name of health security, we cannot completely abandon our other concerns. For example, Northeast India and Assam was already placed in a larger agenda of Axis policy. And in Axis policy, Southeast Asian cooperation is very crucial. So we have seen already, for example, in border areas of Eastern Nagaland, Myanmar, Mizoram, Myanmar, these areas, even COVID-19 outbreak is where the people across the border, they are having to rely on health facilities or health infrastructure in the Northeast Indian side. So those will be the reality where we have to be understanding about. And finally, there is an approach that UN talks about, that is called whole of government approach. Whole of government approach means that there has to be a policy coherence, that what different governments are talking about within their national parliament as well as in the international forums, they all have to become a composed kind of a composite whole. So this different kind of stakeholders have to come together, and because time is almost kind of running out. And I will talk about finally that the premier medical journal called Lancet, which we all know about. Lancet talks about basically the three important approach that they are advising different nation states to adopt now at this moment. That is basically three things. Of course, number one is the digital health solution. That is something they say that Ebola has been a very learning experience of that. That real-time exchange of information is very crucial across national boundaries. Real-time information exchange. Then second is that stronger supply chains have to be ensured at any cost. That means from vaccines to what we are nowadays all of us know as the PPE, that is personal protective equipment. So the stronger supply chain has to be available all the time across governments. And uh, third is organizational development, that is optimizing the performance of all the governments as well as NGOs involved. This is a type of partnership of civil society as well as government. So organizational development across board. And fourth point, which I find very crucial for area like ours, area like Northeast, is that ensuring frontline health workers have a seat in the policy able.
Hmm.
That is, those people who are actually fighting in a battle on the ground in the front line, their saying should have a lot of say. They should become their experience, their perspective should become very important for national level policy making. Because this is why I say this is important for Northeast, is because we have seen that many places there are doctors and nurses really doing their best without adequate support, but at the same time, community support is very strong.
Hmm.
We have to understand how we can rope in this type of support systems. So those type of new kind of innovative techniques has to be there. And India, of course, have some positive example of Kerala model has already
Yeah.
been hailed. Kerala has done really well, and India also has the example of polio, successful case of polio eradications. We
Hmm.
do have some positive examples to share with the world. So, with this broad points, I would like to stop here, and this, of course, can be taken further in questions and answers. Thank you so much.
Yeah, thank you, Dr. Kaustubh Deka. It's a very vividly discussed, point. Although you have been given a very short notice, but you have made the topic looks very, pertinent, and you have made very pertinent discussion on different aspects of this COVID-19, and more particularly from ranging from international concerns to national concerns to regional concern like Northeast India. What can we do, to combat this epidemic, and what are the policy changes that is required? That has been very beautifully discussed by you, and more particularly you have talked about this all stakeholder comprehensive policy making kind of a system where the frontline workers could also be considered as an important agent for policy making, and how can we also develop some kind of a south or regional cooperation. Interestingly, you have talked about the geopolitical concern in COVID-19. You said that there's a importance of geopolitical cooperation and coordination among the nations so that we can combat this problem called COVID-19. So we will talk more about it time and discussing on it. The first question was asked by one of the undergraduate student of our college. His name is Firoz Kanti Brahma, and this question is for Kaustubh Moni Deka. He was mainly asking about that after the lockdown has been over, once everything is reopened, what is going to happen in the lifestyle of the people, like whether it has an impact on the way the people lives, and what is the role of this COVID-19 in the upcoming job scenario, job situation of India. What is going to happen in the job sector, and is it going to change the lifestyle of the people? So, Kostov, how do you address this question?
I'll address now or take more questions. I can address.
Yeah, yeah, you can address now.
Okay, I mean, thank you, Brahma, right?
Yeah, Brahma, Brahma.
Thank you for your question. Yeah, thank you for your question. Of course, this is not strictly within the area I was speaking about. This is more of a general kind of question, and I mean, I think other panelists can also pitch in because it's something that concerns all of us. Uh, Not very easy questions to answer, of course, because these are uncertain times and we are all going through the uncertainty right now.
Mhm.
And going by indications that how different sections of the people of the society are responding, there will not be a simple and straightforward answer. The
Mhm.
answer will depend on how COVID-19 is affecting different people in different ways. We can see that actually some people are pushed to the very edge of desperation. Just this morning, we read this very devastating sad news that 15 workers have been they were mouthed down by a moving train because they were
Yeah.
sleeping exhausted on the tracks. So you can see the differences in when there are some people who are locked up in the house, and our frustration is that we are very bored in the house and we have enough, we have nothing to do, and we don't know how to fill the time. And there are others who are actually desperately trying to reach their homes, walking hundreds of kilometers. So definitely, COVID is affecting different people in different ways. So the response also will be very different. The way it will affect us, some people will be left very devastated and very helpless for many months to come, years to come.
Mm.
Some will recover quickly. So this will be different for different. About lifestyle, it's a very reflective or subjective question, because of course everyone is emphasizing that we have to relook at our lifestyle. We have to cut down on consumerism. We have to be careful in balancing the nature and human balance. All that, if we actually understand the message of this virus, this epidemic, how a lot of people are saying this pandemic, that basically we have in a way caused it by our reckless kind of consumerism and reckless behavior. If we understand the message said, I think lifestyle will definitely change. About job scenario, that is more of a complex question. There are a lot of estimates being made by governments, by different industrial house. Everybody is estimating a huge loss of business and the way across sector.
Mm.
But again, that will depend, as I say, that how innovatively we can tackle the situation. Perhaps we have to change our traditional concept of job and job security. We have to now cope with the change scenario. And of course, there will be loss of kind of jobs and there will be effect. But if we are in a way careful, we have to. That's what there are a lot of proposals about new kind of tax law, new kind of changing of job regulations and all that. We have to be careful of that. At the same time, I will also caution because just this morning I was reading that Uttar Pradesh has in fact apparently demolished a lot of labor laws because they want to attract foreign investment. So we should not also go to that extent that we will be in the name of foreign investment and make use of the opportunity. A lot of companies are supposedly moving from China, they're looking for other places. That is what is in the media. We of course cannot verify. But Uttar Pradesh apparently has now relaxed a lot of labor laws. And it might again rise to exploitation of labor now. So we have to draw this balance somehow.
Yeah. Yeah, Kostov.
Yes.
So that's a very
Yeah.
interesting kind of a question asked to you, and you also have answered it very well. And you talked about how it is going to change the job sector, I mean, more particularly regarding the lifestyle. You have said it's a very subjective question. It depends on the people how we practice our lives. And regarding the job
Yeah.
sector, you said that the laws on job need to be reset. We have to readjust the job sector. Now, I have a question to you. Since you have talked about the regional corporation,
Yeah.
we have certain organizations which have been playing a very, very important role regarding this COVID-19. More particularly, organizations like this World Health Organization (WHO), and
Yeah.
we have been seeing that the WHO has been playing a very important role in more particularly in awareing people and awareing the countries and
Mm.
coming up with different kind of policies how to eradicate the problem of COVID-19. But we also noticed that some of the powerful countries like United States of America, who has been one of the major
Mhm.
investors, more particularly regarding the funding sector to WHO, they
Yes.
have Donald Trump recently he declared that United States of America is going to cease the investment on WHO. Now, in such a
Yeah.
situation, how do you see where do you see the successfulness of this kind of organizations in
Yeah.
addressing the problem like
Right.
COVID-19? Yeah.
Right. Yeah. I mean, thanks for this question because I didn't get time to go into this whole complex politics that is actually being played right now. And WHO example, a lot of people have pointed out that United States have traditionally been not very comfortable with any kind of multilateralism as such. They have also been had problems with WTO also because they want to in a way dominate the international agenda, so they want to make it more like unilateral. So WHO example shows that how, as I was mentioning, that even in pandemic, geopolitical concerns are always there, and different nations are even now trying to, in a way, see the geopolitical gains and loss. So that game is still on. So regarding that, I think, WHO was accused of being pro-China. Then, as you rightly say, US is now very critical of it. But despite of that, what we have to understand is that one lesson that when the COVID has taught us is that there is no alternative to multilateralism. There is no alternative to collaboration between nations and across the society. So that is what we have to emphasize, and that is why countries like India are very crucial because we are seen as in a way the leadership position of the developing world, and we have to keep the larger picture in mind, larger perspective in mind, and not fall for strictly narrow geopolitical games. And quickly, I'll also add here because also China has this one belt, one road kind of dimensions already in place, and Japan has something called Pacific Rim. And so Northeast India was already caught trapped between this Pacific Rim versus one road, one belt, or one belt, one road. So, but now is the time everyone has can relook and understand that these viruses they don't respect nation state boundaries. For them, they are kind of seeing the whole humanity as a target. So our response also has to be the same. Thanks.
Thank you, Costa, for the answer. Please keep on line. Yeah, introduce yourself and ask the question. Yeah. Hmm. Hmm.
Superpower like US is facing a way beyond imagination. On the other hand, a small economy like Cuba is foolish. So now I don't want to go to the whole debate of capitalism versus capitalism. But is this high time for India to stop supporting private sector and try to develop hospitals, government, health sector, make it reachable to everyone? I mean, because only providing insurance to citizens like US is not going to work in a time like this.
Mhm. Okay, so very good question actually. Who want to address? Dr. Kaustubh Deka.
Yeah,
Hello.
I mean,
Yeah,
others can also join.
yeah. You.
But it's a very small, good question. Basically, yeah, even in the United States, that debate is again come back. I mean, he's rightly pointed out that whole issue of Obamacare,
Hmm.
that when the whole the electoral agenda issue in US, that health for all. Britain, US, they're all relooking at their health policy now, and the person who's asking the question is absolutely right that this is a moment also for us to reflect on the accessibility of healthcare. Inclusivity and accessibility is very important key points now, and all the governments, I'm sure, will be compelled to look into it now. And there should be public pressure from different stakeholders, from different sectors on the governments to look into that. Having said that, at the same time, again, we cannot also overlook the huge, corporate dominance, the corporate control over the governments, and how different, especially in drug manufacturing, the corporates have a strong hold. And it will be interesting to see now how this pandemic will force governments to take a strong kind of a position vis-a-vis the corporate control. That will
Okay.
be my.
Hmm. Good. So, Yogen, do you want to add on what Dr. Deka has e-Politica? These are actually created for the benefits of the students, research scholars, and civil service aspirants. And I hope it is for some help to you. Please do subscribe and share the channel among your friends, colleagues, and students if you did not. And if you have any query, please feel free to write to me at gogoi.suseng@gmail.com. And I would also request my students, the listeners, if you have any doubts regarding these modules, do not hesitate to ask me question in the comment section, and also putting a mail to me. And if you need any materials from me, you can also write to me at gogoi.suseng@gmail.com. With this, I signing off. Thank you for watching ePolitica. Keep watching. Stay home. Stay safe. Jai Hind.